Now progressing to the next syndrome, which we'll get to discuss, and this is what is known as the Hurler Scheie Syndrome. Hurler Scheie Syndrome. So for the Hurler Scheie Syndrome, you can see a child having it. Alright, but this is a very typical, presentation. Alright, so they can have issues everywhere, every place, but one of the clinical things you can actually use to always identify if somebody has a Hurler Scheie syndrome is the facial appearance. So it's a form of what? Mucopolysaccharidosis type 1. So it represents an intermediate phenotype between the Hurler syndrome and the Scheie syndrome. It's in between. So it combines features of both. Okay, and of course, if you are combining both, the severity will also be more than what the other ones. So genetic basis, there's a mutation in the gene known as the IDUA gene. So the enzyme affected is the what? Alpha L iduronidase. So pathophysiology will now lead to accumulation of what? Glycosaminoglycans. Mainly the dermatan sulfate is affected, the heparan sulfate is also affected. So inheritance is autosomal recessive. So clinical features usually occurs in childhood, where you're having the dysostosis multiplex, then joint stiffness, short stature. On the facial issues, you're having the coarse facial appearance. The cardiac issues, there's valve disease, there's cardiomyopathy. In the eye, there's corneal clouding, then glaucomas and the rest. Okay. Neurological intelligence may be affected. So other ones, you're having an enlarged spleen, hernias, and the rest of it. You diagnose this from clinical suspicion. Also lab tests to check for the activities of the alpha L iduronidase. Then also you check out for the mutation, right? Genetic mutations. So urine test, you check if there's elevated dermatan or heparan sulfate. So management, you replace the enzyme that is lacking. Then hematopoietic stem cell transplant.